Hi, my name is Jenny Parker. I'm a registered nurse and a certified diabetes care and education specialist with Mount Carmel Health Partners. I want to take a few minutes today to talk with you about the Mount Carmel Diabetes Education Program. In order for you to receive credit for watching this webinar, please return the attestation and the W-9 by December 30th, 2022 to receive the credit. That email needs to go to Desiree Corbin, and her email address is shared at the bottom of the screen. So let's just talk for a few minutes about what diabetes self-management education programming is available at Mount Carmel. First of all, we are fully accredited by the Association of Diabetes Care and Education Specialists. Being fully accredited means that we're able to bill for our services and that we have to meet standards that are set up by the ADCES as well as the American Diabetes Association. Our classes are offered in person at Mount Carmel Grove City Hospital, Mount Carmel East, and Mount Carmel St. Anne's. We also offer virtual classes in a team setting, just like you're viewing right now, and individual sessions with our educators through ClickSoft. We also see all types of patients that have diabetes. Patients with type 1, type 2, or gestational diabetes are all seen. So let's talk just for a minute about the outcomes that our patients have. Patients who attend our comprehensive series, which I'll talk a little bit more about what that means as we move along, but they typically average a 10-pound weight loss in the 3 to 6 months after they've attended our classes. And they also typically lower their A1C by 1.4 to 1.8%. So our classes are extremely effective in managing the care for our patients. So when should you send a patient to get diabetes education? There are lots of times. First of all, anyone that is newly diagnosed with type 1, type 2, or gestational diabetes would benefit from education. If you have a patient that has had an increase in their A1C recently, where maybe the medications are not as effective as they once were, that's also a good time to send a patient for education. If they start a new diabetes medication, maybe that's insulin or some other injectable medication that they might need some assistance with, that's a good time to send a patient. Or if they're developing new complications from their diabetes, problems with their feet or their eyes. We can also do training for the use of continuous glucose monitors or CGMs. Insurance does typically cover our services. Medicare covers comprehensive classes at an 80-20 ratio. They do cover 10 hours of diabetes education, and they do that one time. So it's usually at diagnosis or at one time during their Medicare years. Medicare also, in the additional years after they've had that first year of 10 hours of education, will cover up to 2 hours of training each year. Medicaid and most commercial insurance covers the cost. We will always assist our patients to check on insurance coverage. That's not something that we would leave to them alone or to your office. Our diabetes team will assist in helping the patient with their insurance coverage. So just to tell you a little bit about our comprehensive classes, we cover the 7 skills that all patients need. So we're going to talk with them about healthy eating. We use the Mediterranean diet as well as the MyPlate planner to make healthy food choices simple for the patients. We talk about portion sizes and the importance of meal planning. We talk a lot about exercise and activity and the importance of just doing something is better than doing nothing. We discuss monitoring if that's a part of the patient's care. So when to check their blood sugar, when to be concerned about it, what to do with highs and low blood sugars. We discuss taking their medications. We kind of discuss the different types of medicine, but mostly we talk about taking the medications as prescribed, taking them on time, what to do if you miss a dose, or how to help with maybe affording medications that are expensive, or just different tips and tools for the trade with that. We discuss a lot of problem solving and coping skills. As most of you know, about 90% of managing diabetes is self-management by the patient. And so helping them to identify potential issues and to learn how to handle problem situations, as well as adapting lifestyle changes and getting the support that they need to cope well with their maybe new diagnosis or their ongoing diagnosis of diabetes. We also talk to them about stopping smoking, getting healthy checkups, performing daily self-care activities in our classes. Patients can be seen typically as a one-time individual visit, and then they also can be seen for the additional 9 hours of group classes. So our one-time individual visits are typically for gestational diabetes patients, insulin instruction, or we always see any non-English speaking or patients who have hearing issues in a one-on-one setting, not a group class. Most insurance also will cover the 9 additional hours of group classes that we offer. Those are done in 4 2-hour sessions. Those classes are taught by nurses and dietitians, most of which are also certified in diabetes education. So it's important to remember the diabetes eye exams. Those are to be done for patients between the ages of 18 and 75. Documentation of a retinal or a dilated eye exam by an eye care professional is important to be put in each measurement year. A negative retinal or dilated eye exam by an eye care professional in the 2 years prior or during the measurement year. So in other words, it's good for 2 years. There are some exclusions to this requirement. If the patient has polycystic ovaries, gestational diabetes, steroid-induced diabetes, if they are in hospice or using hospice services, receiving palliative care, or if they died during the measurement year, then that would not be required. So as far as contact information, if you would like to schedule diabetes education session for a patient, we try to make it as simple as possible. You can call Brenda Thomas, and I have her number on the screen, and we will leave that up for a second here so you can write it down. Brenda is the administrative assistant for all 3 of our sites. She will take care of everything once you've given the order. She will contact the patient and get them scheduled for their individual as well as for their group classes. She will talk with the patient about how their insurance coverage will work and what kinds of things that they need to connect with the insurance company. I've also put my contact information on there as well as my email address. I certainly would be happy to assist if you have questions about our program, or if you just have diabetes education questions in general, I'm the right person to contact. And just a final reminder to please return your completed attestation and W-9 after watching this video to Desiree Corbin by the end of this year.